Hi, I'm Dr. Evan Matthews. I'm here doing the fourth section of the Cardiovascular Physiology lecture set. The first one was all the anatomy of the heart. The second one, we covered cardiac output, heart rate, and stroke volume and how they interact together. The third one was all about blood pressure. And this, the fourth and final part, is going to be all about blood pressure and blood flow and how they work together. All right, so let's go ahead and get started. So you can see here on this diagram, we have an equation that it's flow equals pressure 1 minus pressure 2 divided by resistance. All right, so this equation is very, very similar to an equation you've seen before. I'll show you that in the next slide, though. But basically all it's saying is that the forward movement of blood, so blood flow, is going to be controlled by the pressure 1, which is the pressure moving the blood downstream, and minus pressure 2, which is the pressure pushing back against that. All right, so again, you have pressure pushing down, pressure pushing up, and whichever one's greater, that's the direction that the blood is going to flow. And typically in the body, the pressure is always going to be greater in that P1, so the first pressure. The greater pressure 1 is compared to pressure 2, the more the blood is going to flow in that direction. Now, the other thing that affects the blood flow is the resistance. So resistance in the body is primarily driven by the vessel diameter. So you can see that I have here some arrows suggesting that the vessel is narrowing as it goes downstream. So basically we are causing a vasoconstriction, or just a slow narrowing of the vessel, which is pretty much what happens in most of the vascular network. Is the further you go downstream, the more narrow the vessels become. And so that's going to add a resistance to forward movement. All right, so that's what the resistance here is referring to. So as the red blood cells bump up against the walls, as the walls get narrower and narrower and narrower, they start to back out. Think of like a highway. All right, you have a 2-lane highway that slowly turns into 1-lane highway, and that's always going to cause a bit of a traffic jam, so you're going to slow the flow. All right, so with this, again, the resistance, the higher the resistance, which is the greater the vasoconstriction, the slower the flow, the less blood flow you're going to have. This is the same thing that we just saw. The only difference is instead of having pressure 1 minus pressure 2, we have a delta pressure. So that triangle there is a delta symbol. Delta just means the difference. All right, so it's the difference between pressure 1 and pressure 2. So this equation here should look familiar to you. If it doesn't, go back and watch some of the previous parts of this cardiovascular physiology lecture set, because we've seen this equation before. We have cardiac output equals mean arterial pressure divided by total peripheral resistance. So if the mean arterial pressure is greater, that is going to increase the flow. If the total peripheral resistance is greater, that's going to decrease the flow. So just like this equation over here, it's the same exact equation. It's just this one is looking at a single blood vessel, where this one is looking at the entire body. So you can see we have sort of a block diagram of the heart, and we have the entire vascular network, artery all the way through veins and back to the heart. So this represents the entire body, where again this just represents a single blood vessel. But the equation is really the same. It's just different words placed into the equation, but it's the same exact formula. This formula just comes from some basic physics formulas. So a lot of what you're going to see in the cardiovascular system as far as these equations just comes from physics. So it's not like we invented these equations. We just put our definitions and our terminology into those physics equations. So all this is a flow equation that's tied to pressure and resistance. The reason why over here we needed a delta pressure, so this pressure minus this pressure, and over here we just have mean arterial pressure, is because the pressure coming out of the heart is equal to mean arterial pressure, where typically by the time you get back to the right atrium, pressure is 0 or very, very close to 0. So we just, for simplicity's sake, make that a negligible part of the equation, and so we simplify this pressure into just a single number, the mean arterial pressure, rather than a pressure difference between two pressures. Resistance can be affected by more than just the diameter, though. So here, radius is basically the same as diameter, it's just radius is half of a diameter. So here's the diameter or radius in the equation to calculate resistance, but there are two other things that affect resistance. There's the length of the vessel, and there's the viscosity of the fluid going through that vessel, and the fluid here being blood. All right, so If you make the vessel longer, so this vessel, which is longer than this vessel, that's going to increase the resistance. Likewise, if you increase the viscosity, so you can see that this blood is very thin, there's not a lot of congestion. This blood is very thick, the red blood cells are right up against each other, there's a lot of them, there's not a lot of fluid in between them, so that's a more viscous fluid. The more viscous fluid is going to also increase resistance. And over here, we have a large vessel with a big radius or big diameter, and we have a smaller vessel with a smaller radius. All right, so the smaller radius vessels also are going to increase resistance more. All right, so this is the high resistance vessel, this is the high resistance fluid, and this is the high resistance vessel. But if you look at these three scenarios here, we don't typically increase or decrease the length of our vessels. Right? They will increase over time if you gain additional muscle mass or fat mass and you have to add vessels to feed the new tissue. But that's not something that's going to change from moment to moment. It takes a long time for you to need or to lose blood vessels. The viscosity, if you become extremely dehydrated or in a situation where somebody is blood doping or doing something where they're artificially increasing their red blood cell count, yes, you can get highly viscous blood. But again, this isn't something that's going to change from moment to moment. This isn't something our body is doing very often. So these two don't really happen very often in normal physiology, especially not in a regular exercise situation. This one though, the change in the radius, which is vasoconstriction going to the smaller one, this does happen all the time. This happens all day long to you several times a day. Your moment to moment, your vessels can go from small to big and back to small again. And basically all this is whether or not the smooth muscle is contracted. And remember, smooth muscle contracts in the blood vessels when they are stimulated by the norepinephrine from the sympathetic nervous system. So when our body wants to change the resistance, it's not going to change the length of the vessel, it's not going to change the viscosity of the blood. What it's going to do is it's going to change the radius of the blood vessels. And that's the good news here is that the radius is to the fourth power. All right, which means a small change in radius is going to make a huge difference in resistance, where these, you would have to do a very large change in the length or the viscosity to really make much of a difference in resistance. So the radius is the most powerful of the three. It's also the one that our body chooses to use in order to change the resistance of the blood flow through the body. And again, going back, the resistance is very closely tied to pressure and the blood flow. So it's an important thing for our body to constantly manage. All right, so let's try to put some of these concepts together here. This is just a slide from a research subject. So this is all real data from a real individual. And we also have some other real information from people here. So this is what a premature ventricular contraction of the heart looks like, which is something we're going to be talking about here. And this is also a video. These are both echocardiogram videos, so ultrasound of the heart. Both of them are showing premature ventricular contractions. All right, so if you don't understand what I'm about to show you here, it's probably not a huge deal at the moment, but if you can grasp this, I think it's going to put a lot of the concepts together for you. A PVC, or a premature ventricular contraction, is when the ventricles contract before they're supposed to. All right, so the ventricles, and what they do is they get irritable for whatever reason, and they contract when they haven't had a chance to fill with blood yet, or they haven't filled up with blood enough. All right, so usually they contract before the atriums have a chance to contract. And so if you look at this this data here, let's just go down and I'll tell you what each thing is. This is the electrocardiogram, the ECG. This is your cardiac output. This is a continuous tracing of blood pressure. This is from a little finger cuff. Here we have sympathetic activity, so sympathetic nervous activity. So these TP shapes here are basically bursts of sympathetic activity. And then we have vascular resistance across this bottom channel. All right, so now what I'm trying to show you here, this weird looking beat here, and there's another one right here. You can see they look different from the other heart cycles. Those are PVCs. Those are premature ventricular contractions. When you have that premature ventricular contraction, remember that means that the ventricles contract before the atriums, which means they're not filled with blood the way they should. So you're not going to get a lot of blood flow out of the heart when that happens. Look at the cardiac output tracing. There's this big dip in the cardiac output after each one of these PVCs. So again, you don't get enough filling of blood in the heart before it contracts, and then you get this big drop in cardiac output because not enough blood was ejected, so stroke volume's low too. If you remember back, cardiac output is going to affect blood pressure. So look at the blood pressure during that PVC. Here's again that other PVC, so this is also a PVC. And look at the blood pressure here too. It plummets. So cardiac output plummets, blood pressure plummets because cardiac output plummeted, and then our body is going to sense that. The primary way it's going to sense it is with the baroreceptors using the baroreflex. So it has this constrict, so the aorta and the carotid sinuses, the carotid arteries, they're going to start to collapse a little bit, which means they're not being stretched. And that's going to be sensed by the baroreceptors, which are going to let the brain know that there's not enough blood flow. But then when the brain thinks there's not enough blood flow or blood pressure, it's going to increase sympathetic activity. So you can see, again, after each of these PVCs here, there's this big spike here. Here's another big spike. That's a huge increase in sympathetic activity. All right, much bigger than the little spikes that came right before each of these. So these are normal spikes. This is a huge spike. Normal spikes, huge spike. All right, so sympathetic activity goes way up, and if sympathetic activity goes up, that's what drives the vasoconstriction. If vasoconstriction happens, you're going to get an increase in peripheral resistance, and look, resistance skyrocketed immediately after the spike. All right, so you can see that, again, the premature ventricular contraction caused a decrease in cardiac output. That decreased cardiac output caused blood pressure to plummet. The blood pressure plummeting sensed by the baroreceptors caused an increase in sympathetic activity. That increase in sympathetic activity caused an increase in vascular resistance. All right, so this just kind of puts all the things we've been talking about together in a single real-life situation. All right, so PVCs are something that happens to people all the time. It's just a few here or there. It's not a big deal. But you can see how they can pretty quickly get to the point where they're affecting your ability for your heart to do its job. All right, so again, if this is too much for you, it's probably okay at this point to ignore this slide. But if you can grasp this, I think it's going to help you understand everything that we've been covering here. But if you're not quite getting it yet, go back and study the other information and see if this makes more sense. All right, so let's talk now about more local and regional blood flow. All right, so when you start to exercise is going to cause your sympathetic activity to go up across the body. All right, all the body is going to see an increase in sympathetic activity. And I just told you sympathetic activity is going to cause vasoconstriction. So if we have vasoconstriction across the entire body, that means the vessels are going to be shrinking and there's going to be less blood getting through them, causing blood pressure to go up. So that's part of why systolic blood pressure goes up when we exercise. So though if you are constricting everything, you're decreasing the blood flow to the entire body, what about the part of the body that's doing the exercise? So let's say you're cycling, right? You're on an exercise bike or something. The leg needs more blood flow, but you have sympathetic activity going to the leg, which would cause constriction, preventing that blood flow. All right, so the body, specifically each tissue, has the ability to ignore the sympathetic activity. All right, and so that process is something called sympatholysis. All right, so sympatholysis is the local tissue's ability to override the sympathetic activity. And so basically what happens is all the byproducts of exercise that get released when you contract your muscles, so a decrease in oxygen, an increase in carbon dioxide, an increase in nitric oxide production, potassium release, adenosine, which is one of the breakdown products of ATP, decreased pH, so in other words, more acidic tissue. All these things happen when you contract muscle repetitively. So when you exercise, all these things are going to happen. And when those things happen, those are signals to the blood vessel to dilate. And when the blood vessel gets that signal, it's going to dilate whether or not sympathetic activity is dumping norepinephrine on it or not. And the fact that it's able to override that is the process of sympatholysis. So the entire body is constricting, and the tissue that needs the blood flow is going to ignore that signal to constrict, and is actually going to dilate. So it's going to get lots of blood flow, which is exactly what it needs. And so this is a way of stopping tissues that don't need more blood flow from getting that blood flow and diverting the blood flow to the active skeletal muscle. So it's a really neat and necessary mechanism to make sure that you're able to get the blood where it belongs. On that note, let's look at how blood flow is redistributed during exercise. What we have here is at rest across the bottom. All right, so at rest, you got about 5 liters per minute of blood coming out of the heart. So that's 5 liters of cardiac output. And so that 5 liters, that's 100% of your blood flow at rest. During heavy aerobic exercise, you're going to get maybe up to around 25 liters of blood per minute. So 25 liters per minute cardiac output is 100% of your cardiac output during heavy rest. Well, during heavy exercise. All right, so looking at the different organs and tissues during both the resting situation, the gray, and the heavy exercise situation, the red, you're going to see a redistribution of blood flow in a lot of these. At rest, digestion's really high. You're going to get about 20 to 25% of the total blood flow that's coming out of the heart going to the digestive tract. During heavy exercise, it's only around 3 to 5%. So a lot of vasoconstriction there. If you look at the heart, it actually maintains about the same percentage of the total blood flow. So around 4 to 5% blood of the blood supply, regardless if it's at rest or during exercise, which makes sense. The heart's going to be active in both situations. The kidneys, which produce the urine and do some other important things for us, gets about 20% of the blood supply at rest. Only about 2 to 4% of the blood supply during heavy exercise. Going down to the bone, about 3 to 5% of the blood flow at rest, about 1%, maybe a little less than 1% during heavy exercise. So a little bit of constriction here. I didn't mention it, but a lot of constriction in the kidneys, so the renal system gets a lot of constriction. The brain, which is going to be around the same amount of activity either way, it gets about 3 to 5% of the blood flow at rest and about 1, maybe a little less than 1% during heavy exercise. Here's a big difference here. So skin blood flow. So remember, we're going to send blood flow to the skin in order to help cool our bodies down. So that's how we sweat. And that's important for exercise, especially in hot environments. So about 4 to 5% of the total blood flow at rest, up to 20%, easy up to 20% during heavy exercise. It'd probably be higher than that if it was a really hot day. So a lot more blood flow going to the skin. So a lot of dilation in the skin. The skeletal muscle at rest got about 15 to 20% of the blood flow. During heavy exercise, 70 to 85% of the blood flow. So way, way more of the blood flow than it got at rest. All right, so that's the percentage though. So again, the things that got a lot of the percentage of the blood at rest are the digestive system, the kidneys, and to some degree skeletal muscle. The things that got most of the blood flow during heavy exercise are going to be the skin and the skeletal muscle. But if we look at, so that's the percentages, so those are the relative values for blood flow. If we look at the absolute values, all right, so the digestive system got 1.1 liters at rest, got 1 liter during heavy exercise. So it really didn't go down by that much. There was vasoconstriction, which prevented the excess blood flow that it would have got. Because remember, we're getting a lot more blood flow going out to the body. So if it didn't vasoconstrict, it would have got a lot more blood flow. And we don't need that. We don't want that. Looking at the heart, it was 4 to 5% of the blood flow in both situations. But if you look at the absolute values, it's about 0.2 liters at rest it went up to 1.1 liters during heavy exercise. So it actually gets a lot more blood flow during heavy exercise. Now, if we look at the kidneys, it really didn't change that much. It went from 1 liter to about 0.8 liters, even though the percentage went way down. So it is vasoconstricting, but it's still getting a fair amount of blood flow. The bone, it's actually about the same, so 0.2 liters to 0.2 liters. The percentage goes down a little bit just because there's a lot more blood coming out. Again, so a little bit of vasoconstriction, but not much. The brain, it's got 0.2 liters and 0.2 liters, so it's actually getting the same amount of blood flow as well in either condition. Again, it looks like a little less, and there's a little bit of vasoconstriction, but it doesn't change a whole lot. The skin, so here's the big differences again. The skin got 0.2 liters per minute of blood flow at rest, 3.1 liters per minute during the heavy exercise load. So that is way more blood. We're talking, I don't know, about 15 times as much blood, roughly, we'll say. It's quick math, maybe I did that wrong, but it's about 15 times more blood. If we look at the skeletal muscle, same thing, went from 0.9 liters almost up to 20 liters. So almost 20 times as much blood flow during heavy exercise than at rest. So we have two stories here. It depends on what you're looking at. You can look at the percentages, or you can look at the absolute values that I have in these parentheses. And it's going to tell you a little bit of a different story. But the fact of the matter is, both stories are correct and they're both important. A lot of things are constricting during exercise, and a couple things, the skin and the skeletal muscle, are dilating quite a bit during exercise. And that's really the key that you need to take from this slide. One more term I want to relate to cardiac output and also to VO2, which is oxygen consumption, and that is the term arterial venous oxygen difference. AVO2 difference is basically if you were to take a catheter, so if you put it into the vein going to your leg and put it into the artery going to your leg, and then you did some exercise, you would see how much oxygen was extracted from that blood, so how much oxygen left the artery and was not there when it got into the venous side of things. That's what AVO2 difference is. All right, so this is an important value because it tells us, again, about how much oxygen is being extracted by a certain tissue. We're using that oxygen in order to create energy in the form of ATP, adenosine triphosphate. All right, so this can be used in order to calculate oxygen consumption, so total body oxygen consumption. Something called the Fick equation. That's this green equation here. It is the oxygen consumption of the entire body is equal to cardiac output times the average AVO2 difference of the body. All right, so basically, how much oxygen you're consuming is related to how much oxygen is being delivered through cardiac output and how much oxygen is being extracted, AVO2 difference. So it kind of makes sense. But all these equations like this, they all kind of fit together. Notice there's a lot of the same variables, just a different orientation or a few different variables each time. So you can actually calculate between things pretty easily if you get all these equations all in one place and kind of look at how they interact. And it's an important thing to do while you're studying this information. All right, so that is the end of the cardiovascular physiology section. If you have any comments or questions, you can put those in the comments section below and I'll try to get back to you. I know that was a lot of information, but it's also really important because it's a huge factor with exercise, and it's also a huge factor with your health. So make sure that you understand this material. Take some time, study each chapter or each section of this chapter set. So again, there are 4 different parts to this, 4 different videos. So make sure you study each one of those and try to study them in order because they kind of build off each other a little bit. But again, if you have any questions or comments, put those in the comment section below and I'll try to get back to you. Otherwise, please come back and watch another video. Thanks.